The room went dead silent when she folded the third corner. Margaret Walsh stood in the ICU linen closet at Cedar Creek Medical, her hands moving with geometric precision, 90-degree angles, hospital corners tight enough to bounce a coin. The fluorescent lights hummed above her like generator engines. Antiseptic smell sharp as cordite. She'd been folding linens for 3 years here in Norfolk, invisible to most of the staff, but the way she creased each fitted sheet, methodical, deliberate, no wasted motion, said something to anyone paying attention. Something her personnel file would never capture. Dr. Pierce was paying attention. He stood in the ICU doorway, observing. The white coat caught the light like teeth. His shoes clicked on the tile floor as he moved deeper into the unit, his presence announcing itself the way certain animals announce themselves, not with sound, but with the way the air pressure changed around them. He was tall, 50s, the kind of handsome that comes from never being told no, from a lifetime of people stepping sideways when he approached. His left hand bore a wedding band and a Rolex that cost more than Margaret's monthly rent. His right hand held a tablet displaying patient charts. His eyes held something colder. He watched her move through the unit. Watched her check the post-op drain on bed for without letting the tubing kink. Watched her adjust the bed height so the four-pole didn't strain the patient's arm. Watched her communicate with the cardiac monitor the way other people communicated with beloved dogs, reading what it wanted to tell her before it finished the sentence. The patient in bed for was Mr. Hendricks, 73, bypass patient, extubated 6 hours ago. Mr. Hendricks had requested Margaret specifically when he came out of anesthesia. Requested her by name while the resident stood around offering nothing but medical school credentials and clipboard competence. That was the problem, from Dr. Pierce's perspective. That was the only problem that mattered. Margaret felt him watching. She didn't look up. The left side of her body carried old scars from shrapnel, thin white lines crossing her forearm where she reached for supplies, barely noticeable unless you watched her in bright light, which he was. The kind of scars not left by scalpels. The kind left by things that exploded in the dark 13 years ago, in a province called Helmand, in a war that everyone wanted to forget. She had a slight limp favoring her left leg, barely detectable unless you watched her climb stairs. She'd learned to hide it. She'd learned to hide everything. How long have you worked here? His voice came from behind her. Smooth. Educated. The kind of voice that assumed answers would be provided. She turned. Hand steady. Eyes level. 3 years, doctor. Her voice was soft, careful not to take up space. Welcome to the ICU. He smiled like a shark recognizing movement in the water. I'm Dr. Pierce. I'll be overseeing several protocols here. I noticed you just now, your efficiency with basic patient care is functional. Textbook, one might say. Functional. Textbook. Words designed to sound like praise and taste like dismissal. I try to do my job well, Margaret said, folding the last sheet, corners meeting at perfect angles. The patient seemed to appreciate it. Patients appreciate many things. He moved closer, his tablet catching the light. What they need is surgical precision, not just bedside manner. Tell me, when was the last time you updated your critical care certification? Last month, she said. Advanced ACLS. Trauma nursing specialization. Hemodynamic monitoring. He nodded like she'd said nothing at all. Like she'd confirmed something he already knew, that she was competent enough to follow instructions but not capable of thinking beyond them. He didn't know that every certification she carried had come from military medical training. That advanced ACLS meant something different when you learned it in a forward operating base. That hemodynamic monitoring was different when the patient was bleeding through a blast wound and the nearest hospital was 2 hours by Black Hawk. He didn't know any of that. No one here knew any of that. The fluorescent lights buzzed overhead. A monitor beeped, patient in bed 2, oxygen saturation dipping slightly, nothing critical. Margaret moved before Dr. Pierce could turn his head. She adjusted the patient's head position. Within 30 seconds, the saturation climbed. 94. 96. Stable. Dr. Pierce watched. Simple positioning, she said quietly. Sometimes that's all we need. He made a note on his tablet. Whatever he wrote, it wasn't going to help her. By 11 o'clock, Margaret was in her locker on the basement level. 12 feet wide, paint peeling from the walls in long curls like old skin. Her shift ended at 3. She had 4 hours before she'd clock out and drive home to the apartment in Ghent where her 16-year-old son was probably not doing his calculus homework. The locker held the usual things: an extra scrub top, compression socks, a travel mug with military-grade stainless steel insulation. And behind the spare shoes, on the back wall where no one would see unless they looked, a folded flag in a shadow box, triangle-shaped, edges crisp as a knife. White, red, and blue, 13 years of dust and closed eyes. The flag had belonged to Captain James Holloway, platoon leader of the medical detachment she'd served under. 3 of them had died in Helmand Province. 3 of them were buried in Arlington National Cemetery under the names the Pentagon had cleared for release. Captain Margaret Walsh wasn't buried anywhere because Captain Margaret Walsh was officially dead, KIA, according to a colonel who'd explained it carefully, compassionately, in a room with no windows and a red classified stamp on the door. Stay dead, he'd told her. For the mission. For the security of ongoing operations. For the 18 months you spent training indigenous forces and running stabilization operations that we will never acknowledge. You have a new life now. You have a new name. You have a new identity, and if you're smart, you'll forget the old one. Except she couldn't forget Holloway. Except she couldn't forget any of them. She closed the locker door gently and climbed back upstairs. The ambulance arrived at 2:47 p.m., just as the afternoon shift was transitioning to evening coverage. Medic call came through trauma alert channels: incoming Special Forces medic, Helmand Province, blast injury, multiple lacerations, shrapnel lodged in anterior chest cavity, pneumothorax confirmed, pressure bandage applied by field medics, ETA for minutes. The ICU prepared. Trauma 1 was cleared. Equipment staged. Margaret stood in the preparatory area checking the chest tube trays, the suction canisters, the arterial line equipment, her hands moving through the checklist with the kind of automation that came from having done it in far worse conditions. The helicopter rotors shook the windows as they approached. That sound, that distinctive thump-thump-thump of a Black Hawk coming in hot, did something to her chest. 13 years of not hearing it, and her body recognized it like muscle memory recognizes a dance. Like scars recognize the shape of old wounds. The medic came through the trauma doors on a stretcher, his uniform still carrying the dust of a foreign country, his eyes half closed, his breathing labored. Young. 24, maybe 25. The kind of young where everything still seemed possible. He was wearing the insignia of 3rd Battalion, 5th Marines, a dark horse, and when Margaret saw that patch on his shoulder, she felt the weight of the flag in her locker shift, felt all 13 years settle into her chest like a stone. She moved to his side. For access first, 18 gauge in the right antecubital, fluid running wide open. O2 mask, 12 liters. His eyes opened slightly when she adjusted the mask, and for a moment, they were awake and clear and aware. Captain. His voice was thin. Shocked. Captain, is that you? She didn't answer. She couldn't answer. Instead, she checked his pupils, reactive, symmetrical, and moved to assess the chest wound. The pressure bandage was clean, professional work. Combat medic training. Good field medicine. You remind me of our last captain, he whispered. His eyes were closing again. She would have done exactly what you just did. Just knew what to do. No hesitation. She saved, his voice faded. Shock was pulling him under. Margaret's hands continued their work. Hands that had held lives together. Hands that had learned how to operate under mortar fire. Hands that weren't supposed to exist anymore. Dr. Pierce entered the trauma bay just as she was finishing the initial assessment. He stopped in the doorway, taking in the scene, the patient, the equipment, Margaret's efficiency. She didn't acknowledge him. She was speaking to the patient in low, steady tones. "We're going to take care of you. You're going to be okay. Just stay with us." The medic's eyes flickered open one more time. In his delirium, he seemed to see something. Someone. Some version of someone he'd known in a distant place where everything was simpler than this moment. What he didn't know was that Margaret Walsh had just frozen. Not visibly. Not in any way that would show. But inside, something had cracked. Inside, the stone in her chest had shifted, and through that crack, something 13 years old was trying to climb out. The stone in her chest shifted as the conference room doors swung open. 12 residents filed in behind 3 attending physicians and the chief of medicine, their faces eager, their notebooks already uncapped. Dr. Pierce stood at the projector like a conductor before an orchestra, his cufflinks catching the fluorescent light, gold, too bright, the color of someone who'd never held a life in his hands and didn't understand the weight of it. Margaret stood against the back wall. She always stood against the back wall. Pierce clicked to the first slide. Her patient care notes filled the screen, magnified and humiliating. Corporal Danny Torres's chart. Her handwriting. Every intervention she'd made in the last 72 hours reduced to data points and judgment. "Let me show you a textbook example of dangerously outdated nursing practice," Pierce began, his voice carrying that particular contempt reserved for people he'd decided were beneath him. He circled phrases in red digital ink, the cursor moving like a surgeon's scalpel. Patient repositioned every 90 minutes. Increased respiratory monitoring protocol. Enhanced fluid intake assessment. He turned from the screen, his eyes scanning the room, collecting nods. "Our friend Nurse Walsh here seems to think she knows better than established guidelines. This kind of clinical illiteracy is how patients die on your watch." A resident in the front row scribbled the phrase verbatim. Another underlined it twice. Margaret's jaw tightened imperceptibly. The kind of tightening that only someone trained to control her own body could achieve. Her hands, clasped behind her back, remained perfectly still. Her face was a mask, the professional neutrality of someone who'd learned 20 years ago that showing anger only gave your enemies ammunition. She said nothing. But that wasn't the worst part. The worst part was watching Pierce's shoulders relax when she didn't fight back. Predators could sense submission. He'd interpreted her silence as confirmation of everything he was saying. 2 hours later, the conference room had emptied. The residents had scattered to their shifts, their notebooks full of reasons to doubt Margaret Walsh. Pierce moved through the third-floor hallway like he owned it, his coat open, his stethoscope draped across his shoulders like a general's insignia. He stopped at the vending machine outside the break room, positioning himself where his voice would carry naturally down to where Margaret was restocking the crash cart. Dr. Ramos and nurse supervisor Chen flanked him like attendants. Pierce's voice rose, deliberately loud, the kind of volume that wasn't quite shouting but was absolutely meant to be heard. "I honestly don't understand how someone so clinically illiterate keeps her license," he said, jabbing a dollar bill into the machine. "The Board of Nursing must have lowered their standards. Or maybe she knew someone on the committee. You see incompetence like hers and you have to wonder what the actual vetting process even is anymore." The soda can dropped with a metallic clang. Chen glanced down the hallway. Margaret was 15 feet away, visible to everyone in that hallway, loading epinephrine vials into the crash cart in perfect rows. Crimson vials. Steady hands. No reaction. Chen expected something, a flinch, a flush of color, a tremor. Expected the shame to hit like it was supposed to. Margaret's hands didn't hesitate. The vials went in. Click, click, click. Perfect spacing. Perfect arrangement. The hands of someone who'd never let emotion interfere with preparation. That afternoon, the rail breach came. Margaret was at the medication distribution station reviewing post-operative orders when she caught it, a dosage on one of Pierce's charts. Propofol. The calculation was off by a factor of 10. A patient in room 407 was about to receive enough sedation to stop his breathing. She pulled the chart, walked to the nurse's station where Pierce sat reviewing labs, and placed it in front of him without preamble. "Medication order on Torres's post-op protocol," she said quietly. 10 times the intended dose. Pierce didn't look up. His eyes stayed fixed on his computer screen. When he spoke, his voice was low and cold, a threat delivered like a casual observation. "If you question my orders again, Walsh, I will have security escort you from this building. Do you understand me?" His eyes finally met hers. Gray eyes. The color of a winter sky with nothing warm behind it. Eyes that had never learned that lives were fragile things. Margaret nodded once. She walked to the chief resident, showed her the chart without mentioning Pierce, and the order was corrected through proper channels. The medication came from pharmacy with the corrected dose. The patient in room 407 received what his body needed. But the damage was already planted. From his bed in the trauma unit, Corporal Danny Torres had watched the exchange at the nurse's station. He'd seen the way Pierce's body language changed when Margaret approached, the shoulders squared for combat even in a hospital hallway. He'd seen her nod, accepting something, and then watched her move through the unit with the same efficiency she brought to everything. No anger. No wounded dignity. Just the next task and the one after that. Later, when she came in to check his vitals, he whispered something that made her hand still on the monitor. "You remind me of our last captain," he said, his voice rough from the ventilator tube that had been removed 6 hours earlier. "She would have done exactly what you just did." Margaret's fingers resumed their work, her face revealing nothing. But inside, the crack that had opened the night before grew wider. Inside, the stone in her chest shifted again, and through that gap, something 13 years old was clawing toward the surface. She checked his oxygen saturation. 98%. His heart rate steady at 72. The monitors sang in beeps and whooshes, the hospital's mechanical lullaby, the sound that had become more familiar to her than her own breathing. "You should rest," she told him, and her voice was steady, clinical, professional. What happened next didn't just silence the room, it ended careers. Corporal Torres crashed at 1,400 hours on day 4. Margaret was adjusting his chest tube when his monitor flatlined, the electrical rhythm vanishing like a light switch. His chest wound erupted. Blood pooled beneath the gauze faster than gauze was designed to absorb. The suction hissed. The alarm screamed. Dr. Pierce was 20 feet away at the monitor, frozen, staring at the falling numbers like they were written in a language he didn't speak. 60. 50. 40. 30. Margaret didn't hesitate. She didn't call for permission or wait for authority to descend. She hit the code button with her palm, and in the same motion, her hand moved to the crash cart. The blade came free, smooth and fast, 14-gauge thoracotomy knife, the weight of it familiar, the grip muscle memory from a lifetime that didn't officially exist. She opened Torres's chest at the bedside. A field thoracotomy, the kind performed in combat zones where there is no time for niceties, performed with the precision of someone who'd done it in foxholes under mortar fire, performed with hands that had held the difference between living and dying in their palms 100 times before. Her hands disappeared into his chest cavity. Her fingers found his heart and began manual compression, not delicate, not textbook, but effective. Necessary. Violent and saving in equal measure. "Clamp here," she commanded, her voice dropping an octave, becoming something other than clinical. Becoming command. Suction. "I need 2 units ONEG now." The surgical team arrived in 4 minutes. Dr. Castellano, the attending thoracic surgeon, took one look at the open chest and the competent manual cardiac massage and stepped beside Margaret without a word. They worked in tandem, the rhythm of people who understood that silence meant efficiency, that every second was currency in a patient's survival. Torres stabilized. Margaret stepped back and stripped her gloves. Her scrubs were soaked in blood. The latex tore away, skin side out. She wore the blood like evidence, like a badge of what she'd just done and what it meant. Dr. Pierce was already in the hallway, already on his phone, his voice sharp and betrayed. "I need the hospital board convened immediately," he was saying. We have a reckless cowboy practicing medicine without a license. Unauthorized surgical intervention. Clear violation of scope of practice. I have 12 witnesses. Margaret washed her hands at the scrub sink. The water ran red. She watched the blood spiral down the drain in a rust-colored vortex, watched it disappear into the pipes and away from the fluorescent world above. She didn't speak. She didn't defend. She didn't explain that she'd just saved a man's life using a skill that officially didn't exist. By 1700 hours, Pierce had contacted the Virginia Board of Nursing. By 1800 hours, he'd filed formal complaints with the state medical board and triggered an external investigation into her unauthorized surgical procedure. He leveraged connections, 20 years of board members, licensing officials, hospital donors, people who'd learned to owe him favors. The investigation was already predetermined. The machine had been set in motion. There was no stopping it now. And Margaret Walsh, the floor nurse at Cedar Creek Medical who'd been carefully invisible for 3 years, was about to learn that silence didn't protect you. Competence didn't protect you. Nothing protected you from someone who decided you were a threat. The next voice they heard wasn't kind. It was institutional, cold, and it came with paperwork. Corporal Torres crashed at 1,400 hours. Margaret was adjusting his chest tube when the monitor shrieked. One sustained note. The kind of sound that stops time. His oxygen saturation plummeted from 94 to 87 to 76. His blood pressure collapsed like a building losing its foundation. The surgical team was in the OR upstairs. The trauma surgeon was 30 minutes out. Cedar Creek Medical didn't have a trauma unit, it had Margaret and a crash cart that always seemed 3 seconds behind. Dr. Pierce stood at the bedside, watching the monitor with the expression of a man reading someone else's mail. His hands remained at his sides. His mouth opened, then closed. Nothing emerged. Torres's chest heaved. Once. Twice. Then stopped heaving altogether. The wound, the one Margaret had been monitoring for 36 hours, began weeping dark blood. Not oozing. Weeping. The internal hemorrhage had found its exit. His heart rate flatlined into a long, accusing tone. Margaret moved. She didn't run. Runners panic. She walked to the crash cart with the specific precision of someone who had done this in a foxhole under mortar fire, her hands already reaching for the scalpel. The blade caught the light, stainless steel, surgical grade, waiting. She'd seen this same cut performed on combat medics in Helmand Province, performed it herself 3 times during a single 72-hour period when the medevac helicopters couldn't land and the wounded kept coming and the choice was emergency thoracotomy or burying another soldier. Her hands moved on their own. The incision ran from the 4th to the 5th intercostal space, her blade moving with the confidence of muscle memory that 13 years of civilian nursing couldn't erase. The skin parted. The fascia beneath gave way. Rib spreaders, she had them out before conscious thought could interfere. The pericardium opened like an envelope sealed with blood. Pierce made a sound. Something between a gasp and protest. Margaret didn't acknowledge it. Her hands were already inside Torres's chest, feeling for his heart, finding it, beginning the compressions that only worked when you were willing to break every protocol, violate every standard of care, and operate outside the law. 1 compression. 2. 3. The heart responded like an engine sputtering to life. Oxygen-rich blood forced back into the brain, the lungs, the extremities. O2 sat climbed, 68, 72, 79, 84. His rhythm returned, sinus rhythm, steady, the most beautiful sound Margaret had heard in 3 years of watching Dr. Pierce parade his credentials like they meant something. Get me 2 units O negative and call surgery, Margaret said. Pierce's face had gone the color of hospital walls. He wasn't moving. Wasn't calling. Wasn't doing anything except standing there like a man who'd just realized his expensive degree didn't account for moments that required hands instead of credentials. Doctor, Margaret said, and the word was a command in the body of a question. Call. Surgery. He left the room. It took him 47 seconds. Margaret counted. She always counted in crisis, seconds until collapse, minutes until brain death, hours until the window closed permanently. The surgical team arrived in 12 minutes. They took over from her hands, which were slick with blood that wasn't hers, and Margaret stepped backward, her composure intact as a reinforced wall. She'd saved him. She'd also ended her career. Pierce had left the room, and Margaret knew with the certainty of someone who'd survived 3 deployments what came next. The phone calls. The incident reports. The weaponized testimony from nurses he'd coached. The state board. The attorneys. The 30-slide PowerPoint presentation meticulously documenting her violations of scope of practice. He would move fast now. She'd embarrassed him in front of residents, in front of the surgical team, in front of a corporal from 3rd Battalion, 5th Marines who would live because Margaret's hands remembered what her mind had spent 13 years trying to forget. The disciplinary hearing convened 48 hours later in the hospital's administrative conference room on the 3rd floor. 6 board members in dark suits arranged around a mahogany table that smelled like furniture, polish and institutional power. 2 attorneys, one for the hospital, one representing the state board. A representative from the Virginia Board of Nursing, her reading glasses hanging from a beaded chain. Fluorescent panels overhead cast the kind of light that made everyone look guilty. Margaret sat in her dress uniform, civilian dress, navy scrubs pressed with creases sharp enough to cut skin. Her hands rested flat on the table. She'd considered wearing her dress blues, the uniform that would have explained everything, answered every question before anyone asked it. Instead she wore the clothes of a woman pretending to be ordinary. Pierce presented for 43 minutes. His PowerPoint slides advanced with the rhythm of someone who'd rehearsed this. 30 slides documenting a pattern. A precedent. Expert testimony from Johns Hopkins, a colleague. He called the man, though they'd never spoken in person, just exchanged emails Pierce had carefully crafted to solicit the answer he wanted. Statements from 3 nurses whom Margaret recognized as people Pierce had coached during his first month at Cedar Creek, walking them through the thoracotomy, asking leading questions, suggesting interpretations. Ms. Walsh repeatedly demonstrated poor judgment, Pierce said, and his voice carried the kind of certainty that comes from never having held a life between your hands and felt it slip away despite everything you did. Margaret listened. She didn't interrupt. She didn't defend. She didn't explain. The board chair, an older woman with iron-gray hair and a name tag that read Patricia Holbrook, RN, finally leaned forward. Ms. Walsh, do you have anything to say in your defense? Margaret's jaw was set the way it had been set for 13 years, not tight enough to show anger, loose enough to show nothing at all. Her voice came out level, measured, the voice of a nurse who'd followed protocol. No, Because 13 years ago, after her Special Forces Medical Detachment's mission in Helmand Province had been buried along with 3 of her soldiers, a colonel named Graves had walked into a field hospital tent and told her that Captain Margaret Walsh was officially KIA. The paperwork was filed. The death notification was sent. The memorial service happened without her there to attend it. She'd been reassigned, or rather, UN assigned, to a new identity, a new name, a new life where she was permitted to be nobody at all. The colonel had been specific, if anyone ever finds out who you are, the entire operation becomes compromised. The 3 soldiers we lost become a liability instead of a loss. You need to stay dead, Margaret. For them. The decision was unanimous. Immediate termination. License suspension pending full investigation. A notation in her permanent record that would follow her to every hospital system in the country. The board chair signed the termination letter with a pen that probably cost more than Margaret's monthly mortgage. 1 signature and 13 years of anonymous service meant nothing. Margaret nodded once. She signed the acknowledgement. She left the room without making eye contact with Pierce, though she could feel him watching her like a wolf that had finally cornered its prey. Her 16-year-old son Jake waited in the parking lot outside the administrative building. His face was stricken in that way only teenagers could manage, the particular desperation of someone who'd never been powerless before. His mother didn't lose. His mother didn't break. His mother didn't walk out of a hospital with a letter saying she was finished. "Mom, this is insane," Jake said. "Tell them who you are. Tell them about." "No." Margaret kept walking toward her car. "You know I can't." "But they fired you. They fired you for saving someone's life. That's insane." Margaret opened the driver's side door. The car smelled like vinyl and the phantom scent of coffee from this morning, when the world had still made sense. Some things are bigger than one person, Jake. One person's career. One person's reputation. You understand? He didn't. She could see it in his face, the incomprehension of someone young enough to believe that honesty solved problems. That night at 2300 hours, Margaret returned to Cedar Creek Medical. Not to the ICU. Not to the third-floor administrative offices. She went to the basement laundry facility, where industrial washers hummed their mechanical lullaby and the smell of bleach cut through every other scent. The fluorescent lights flickered. One was dying, the tube inside already browning at the edges, ready to surrender. Margaret folded her scrubs for the last time. Navy blue, pressed and waiting. She ran her hands across the fabric, smoothing the creases with the same care she'd once used to fold the flag of Petty Officer Sarah Chen, the corpsman who'd taken the bullet meant for Margaret during a compound breach in Sanjin Valley. The flag had been folded by military hands, though. Precise military folds. Margaret had kept it in her locker at Cedar Creek Medical, the only piece of her actual life she'd allowed herself to carry forward. She'd stared at it sometimes during her break, touched the corner of it, remembered what she'd been before this. Each fold precise. Each corner aligned. The indignity of it, Margaret Walsh, who'd commanded 72 soldiers, who'd trained indigenous forces in trauma medicine, who'd performed emergency procedures under fire, folding scrubs under flickering basement lights while the industrial washers churned and the hospital continued above her like she'd never existed. The final fold. The final moment in this dead identity. She set the folded scrubs on the shelf next to her discharge paperwork. Somewhere upstairs, Corporal Torres was probably waking in recovery, his chest held together by surgical sutures and the knowledge that someone had cracked his ribs open and compressed his heart until it remembered how to beat. He would live. He would graduate from this hospital and tell people that a floor nurse named Margaret had saved his life. Nobody would believe him. Nobody would know that the real name was Captain, that the rank had been buried deeper than any body, that the woman who'd done the impossible had done it while standing at the edge of her own erasure. Margaret turned off the basement lights. The 48 hours between the thoracotomy and the hearing felt like 48 years. Margaret cleaned her apartment in silence, her hands moving through routines, folding laundry, washing dishes, wiping counters, the same mechanical precision that had once kept soldiers alive in a trauma tent under mortar fire. Her son Jake found her at the kitchen table at 2 in the morning, her hands wrapped around cold coffee, staring at nothing. He didn't ask questions. He'd learned not to. But she saw him looking at the shadow box on the refrigerator shelf, the one she'd kept sealed for 13 years, and she shook her head once. The message was clear: don't. The disciplinary hearing convened at 8 in the morning in the hospital's administrative conference room on the 7th floor. 6 board members sat behind a long mahogany table with the weight of judgment etched into their spines. 2 hospital attorneys flanked the director. A woman from the Virginia Board of Nursing sat to the right, her pen already positioned over her notepad like a weapon. The room smelled of coffee and paper and the particular sterile anxiety that comes before institutions destroy people. Margaret entered alone. No lawyer. No representation. She'd waived her right to counsel, and the board chairs had exchanged glances at that. It meant either she was innocent or she'd already surrendered. Dr. Pierce sat in the front row, his tailored suit somehow making him look smaller than he'd ever looked in scrubs, his confidence propped up by the knowledge of what he'd already set in motion. He'd made 17 phone calls in the past 2 days. Margaret learned this later, but in that moment she simply watched his hands grip the armrest like they were anchoring him to earth. He had connections that went deep, hospital board members who owed him referrals, colleagues in Arlington who'd worked with him at Walter Reed, a state board contact he'd cultivated over 2 decades of careful networking. He'd weaponized every single one. The narrative was already written before she walked in: reckless cowboy medicine, unauthorized procedures, a nurse operating outside her scope, putting patients at risk through ego and insubordination. The director opened the file. Margaret's incident report. Photographs of the patient chart. The code documentation showing she'd called a thoracotomy without an attending physician present. Captain Walsh, Director Hammond began, and he used her rank without knowing why. It was written somewhere in the employment file, her discharge papers buried under 16 years of civilian life. Margaret's name was listed as Margaret and Walsh, Captain, retired. Someone had been thorough. You performed an emergency thoracotomy on Corporal Torres without proper authorization. You acted without consulting the attending physician. You used surgical technique that, according to Dr. Pierce's assessment, violates current standard of care. The words hung in the air like a diagnosis. Margaret sat with her hands folded on the table, her posture perfect, her face a mask of professional neutrality. The kind of composure that comes from having sat in briefing rooms before operations that had no official names, from having held men's lives in her hands while commanders made decisions that would never appear in any record. She said nothing. Not because she was afraid, but because she understood something the room did not: speaking would be surrender. The colonel who'd ordered her to disappear had also made her a promise: stay quiet, and the people you love stay safe. Every word she offered would be weaponized. Every explanation would be twisted. She'd learned the hard way that institutional power doesn't tolerate explanation. It tolerates silence or annihilation. Margaret chose silence. "Do you have any statement?" Hammond asked, almost gently. Margaret shook her head. "One motion." "Complete." Dr. Pierce's hands tightened on the armrest. He'd expected her to fight. Fighting would have given him an opponent. Silence was something else entirely. It was the absence of a foothold. The Virginia Board of Nursing representative spoke next. "We have initiated a formal investigation into your nursing license. You will be suspended pending the outcome." Margaret nodded. She already knew this. The security guard had called her shift supervisor already, had told her not to come in. Her badge had been deactivated at 4 in the afternoon yesterday. She'd tried to enter the unit for a forgotten stethoscope and the reader simply blinked red. Access denied. The hospital was already erasing her. The hearing lasted 90 minutes. At the end, Hammond stood and read from a prepared statement: effective immediately, Margaret Walsh is terminated from employment at Cedar Creek Medical. Your final paycheck will be mailed. You are no longer authorized to be in this facility without security escort. The words were practiced, delivered like lines in a play that had already opened and closed. Margaret stood. She extended her badge on its lanyard toward Hammond. He didn't take it. Security had already handled that part. She turned and walked toward the door, past Pierce, who'd suddenly found something fascinating to examine on his hands. The next morning, she returned. The ICU was quiet. 7 o'clock shift change, most staff in the daily huddle at the nursing station. She walked past beds where she'd spent 18 months of the last 3 years, where she'd held for poles and adjusted medications and whispered encouragement to people drowning in their own bodies. A security guard walked with her, a man named Officer Matheson who looked embarrassed about the whole thing. "I'm sorry," he said. She didn't correct him. She was simply a 43-year-old woman losing a job, not a captain who'd once trained medics to operate in darkness using only touch and muscle memory. Locker 847 was in the back, in the small room where nurses stored their personal effects. The door had her name on a paper label, written in handwriting she didn't recognize. She opened it slowly. Everything was still there: her backup stethoscope, her phone charger, a sweater she'd left on the back shift in April. And at the bottom, folded with surgical precision, was the flag. The one from Corporal Martinez. The one she'd held for 13 years. She lifted it out, and her hands didn't shake. they never shook, but something shifted in her chest like a door opening to a room she'd sealed off long ago. That's when the unit doors burst open. Jake pushed through like he was breaching a building, his face flushed with the kind of defiance only teenagers possess when they're about to destroy something their parent built carefully over half their life. He was carrying the shadow box. The shadow box. The one that held the silver star, the purple heart, the bronze star with Valor, the combat medical badge. The one that held the military commission form dated 18 years ago. The one that documented a life that didn't officially exist anymore. Jake, no, Margaret said, and her voice cracked. Once. Half a second. That was all the fear she'd allow herself. Her composure reassembled like a soldier's rig, snap, snap, done. But Jake was already moving toward Corporal Torres's room, his young face set with purpose, and she understood in that moment that he'd made a choice she couldn't unmake, that whatever came next was already in motion. Torres was sitting up in bed. His chest was bandaged, but color had returned to his face. The shrapnel wounds were clean, the incision from her emergency thoracotomy held together with precision sutures. He was alive. That was the only fact that mattered. Jake opened the shadow box. Torres's eyes went wide, not from pain, but from recognition. The kind of recognition that lives in the nervous system before the conscious mind catches up. Icarus 6, he whispered. His voice was rough from the breathing tube, from trauma, from the proximity of death. That's your call sign. You were Icarus 6. A Marine Corps liaison stood from the visitor's chair, Captain Rodriguez, present to debrief Torres on the tactical situation that had gotten him hurt. The room was filling now with the early morning shift, Pierce returning from rounds, 2 nurses, the charge physician drawn by voices that didn't belong to the routine rhythm of the ICU. Rodriguez lifted the silver star from the shadow box. The medal caught the fluorescent light and threw it back like a mirror. He read the citation engraved on the back, his voice steady and formal, for conspicuous gallantry and intrepidity while serving as commanding officer, Special Forces Medical Detachment, during combat operations in Helmand Province, Afghanistan. Dr. Pierce moved forward, his voice rising like a man who still believed volume was authority. This is completely inappropriate. We are in the middle of. The hallway doors opened again. A 2-star general walked through in dress uniform. Major General Sarah Chen. Her uniform was pressed sharp enough to cut, her presence filling the space the way a helicopter's rotor wash fills a room. Everything else became secondary. She moved directly to the shadow box without greeting, without protocol. She looked at the medals. And she saluted them. Not Margaret. The decorations. The gesture carried the weight of all the protocols and honors Margaret had surrendered when she agreed to disappear. Captain Walsh operated under deep cover for 18 months, General Chen said, her voice the kind that comes from having commanded people in combat zones, having made decisions that haunt you at 3 in the morning. Training indigenous forces. Running trauma stabilization in conditions that would break most surgeons. She performed 47 combat surgeries with field equipment and a combat knife. 47. Saved every single one. A Pentagon courier in civilian clothes entered behind her. He carried a folder stamped with classification markings and the word Icarus in red block letters. The folder was handed to Director Hammond with the gravity of a death certificate. The silence in the room became a physical thing. It had weight. Margaret could feel it pressing against her sternum like hands. But that wasn't the worst part for Dr. Pierce. Not even close. Her son pushed through the ICU doors carrying a shadow box, his face flushed the color of arterial blood. 16 years old, shoulders back, movements deliberate, he'd inherited her precision. The shadow box caught the fluorescent glare as he walked, and every eye in the unit tracked him toward Margaret's locker. She turned slowly. Didn't flinch. Didn't speak. Just watched as Jake set the box down with the care of someone placing a live grenade on a table. "Mom, they need to see these," Jake said, his voice steady. "I don't care what you said." Margaret's jaw tightened imperceptibly. 1 breath. 2. She reached for the box, but Corporal Torres's voice cut across the unit from his bed, still weak, still recovering, but conscious and alert for the first time in 72 hours. Icarus 6. Torres sat up, wincing. That's your call sign. You were Icarus 6. The room contracted. Conversation stopped mid-sentence. A cardiac monitor beeped into the silence like artillery in the distance. Margaret opened the shadow box without speaking. Inside, arranged on deep blue velvet, a purple heart with its distinctive heart-shaped medal catching the light. A bronze star with Valor. Combat medical badge. Then, beneath them, nested like a secret that had been waiting 13 years to breathe, the silver star. The kind of medal that comes home in a coffin or a court-martial. A Marine Corps liaison stood from the waiting area chair he'd been occupying for the last 6 hours. Not one of the residents. Not hospital security. A captain with dress blues that fit like they were made for him, with the kind of posture that made the room's geometry shift. He moved toward Margaret with deliberate steps, and behind him came someone else. Someone whose presence made the air pressure change. 2 stars on his shoulder boards. Reduced rank after 18 months of combat operations, field commission, pulled from active duty to oversee black site training operations that no official record would ever acknowledge. Major General Catherine Holloway, Director of Joint Special Operations Command, Norfolk Forward Operating Base. Her uniform hung on her frame like a weapon holster. She had Margaret's eyes. The general stepped forward and saluted. Not a casual gesture. A full military salute, rendered to the shadow box and its contents like they were a flag at a funeral. Then she picked up the silver star and read from the citation engraved on its reverse, her voice cutting through the unit with the precision of a surgical laser. For conspicuous gallantry and intrepidity while serving as commanding officer, Special Forces Medical Detachment, during combat operations in Helmand Province. Captain Margaret Walsh demonstrated exceptional leadership, medical proficiency, and personal bravery under sustained enemy fire, coordinating treatment for 214 wounded personnel across 18 months of deep cover operations. Her actions resulted in 97% survival rate in conditions where baseline mortality exceeded 63%. Dr. Pierce tried to interrupt. He'd entered through the back corridor, still wearing his white coat, still carrying the weight of his authority like a shield. His mouth opened. His hand rose. The general didn't even turn her head. "Stand down, Dr. Pierce." 11 words. The room obeyed like it had been trained by command. The general continued without pause, turning the silver star so the metal caught light from 3 angles at once. Captain Walsh operated under deep cover for 18 months, training indigenous forces and running trauma stabilization in conditions that would break most surgeons. Her medical innovations reduced field mortality by 41% across theater. She volunteered for a second 18-month rotation. The Pentagon denied it. She was extracted on orders and, the general paused, discharged as killed in action. Officially, her death allowed her to live. A Pentagon courier stepped forward carrying a folder the color of old paper. Stamped across its cover, code name classifications that made the hospital administrator's face go pale. The courier opened it to the first page. Margaret's DDL 214. Discharge papers. Everything redacted except the dates and the rank. The hospital administrator read the first paragraph and the blood drained from his face like someone had opened a valve. He kept reading. The folder circulated, to the Marine Corps liaison, to General Holloway, to the nursing director who'd signed off on Margaret's termination papers just 36 hours ago. Dr. Pierce's voice came out thin. "This is a breach of hospital protocol. These records should have been reviewed through appropriate channels. I have every right to demand." "You have no rights," General Holloway said without turning. "Not anymore." And that's when everything Pierce had built began to collapse in real time. The federal review that he'd triggered when he filed his complaint to the state board had escalated. A defense intelligence analysis team had accessed Cedar Creek Medical's surgical database within 72 hours. What they found had nothing to do with Margaret. Dr. Pierce's surgical outcomes showed a pattern, complications that appeared in operative notes, then disappeared from patient records. 16 critical cases over 4 years. 9 of them transferred to other facilities in extremis, marked as discharge stable in his database. 9 deaths he never reported. 9 families who never knew what happened. The Virginia Board of Medicine has opened a formal investigation, the general continued. The FBI has opened a criminal investigation. Your license is suspended effective immediately. Charges pending include falsifying medical records, patient endangerment, and obstruction of federal investigation. Pierce's hands began to tremble. The confidence that had carried him through grand rounds, through disciplinary hearings, through 2 decades of using institutional power as a weapon, evaporated like water on hot asphalt. He reached for his phone. His fingers missed. He tried again. "I need to call my attorney," he whispered. "You're welcome to do that," the general said. From a federal holding facility. 2 FBI agents entered the unit. Not dramatically. Not with handcuffs or spectacle. They simply appeared, the way authority always does when it's absolute. Pierce looked around the room, at the residents who'd taken notes during his grand rounds, at the nursing staff he'd terrorized, at the attendings he'd leveraged his connections against. None of them met his eyes. Margaret stood with the shadow box still open, the medals catching light like they'd been waiting all along. Pierce left the unit with the FBI agents. His white coat was removed. His credentials were surrendered. The moment he disappeared through the doors, the unit exhaled like it had been holding its breath for months. Corporal Torres started laughing. Quiet at first, then louder, the sound of someone alive who didn't think he would be. "Icarus 6, he said again, shaking his head. "I trained under you. 12 years ago. You taught me how to pack a chest wound with a field dressing while hanging from a rope. You showed me that pain is just data. That's why I knew. When you moved that knife, when your hands knew exactly where to go, I knew." Margaret closed the shadow box. Her hands didn't shake. She set it down on her desk, the desk she'd been clearing out just 24 hours ago, the desk she'd thought she'd never sit at again. General Holloway extended an envelope. Thick paper. Official seal. "The President would like you to accept the Presidential Medal of Freedom," the general said. "Ceremony in 6 weeks. The White House has already confirmed your availability." Margaret took the envelope. Opened it. Read the first line. Once. Then again. Jake's eyes were wide, wider than she'd ever seen them, wide enough to hold a future that still had his mother in it. "The President wants to meet you," Jake whispered. Margaret set the envelope down carefully next to the shadow box. 2 objects. 1 folded flag 13 years old. 1 invitation from the highest office in the country. Both saying the same thing, "You're allowed to stop being dead now." 6 months later, Margaret Walsh stood in her new office at Norfolk VA Hospital, Director of Emergency Medicine, overseeing a staff of 42, with authority that came from competence rather than credential. The folded flag sat on her desk in a place of honor, alongside the shadow box with its medals arranged like a timeline. A handwritten note lay beside them, dated from last week, in Corporal Torres's careful script. "You saved me twice, once in that bed, and once 13 years ago when you taught me everything I know. Icarus 6, forever." Through her window, Margaret could see the parking lot. A blue van sat in the employee lot. Priority Medical Transport printed on the side in white letters. Dr. Pierce loaded supplies into the vehicle, gauze packages, saline bags, for stands. His name patch read Pierce. No credentials. No white coat. No title. Criminal charges settled with a plea agreement, 5 years probation, permanent revocation of medical license, community service. He didn't look toward the hospital. He didn't look up. Margaret didn't watch long. She had rounds in 18 minutes. The ICU census was 14 patients. 3 post-operative, 2 trauma, 1 septic shock that had come in at 0300 with a blood pressure of 60/40 and a prognosis everyone had written off before the ambulance doors closed. Margaret had given her 72 hours and a chance. The patient was stable now. Talking. Asking about her daughter. The quietest person in the room might be holding it all together. Margaret closed the blinds and opened her tablet. The past was folded. Honored. Not forgotten. But no longer her present. Jake was starting college in the fall on a military scholarship, but he was studying engineering, not medicine. He'd chosen his own path, watched his mother choose hers. She had a team that respected her not because of medals but because she showed up, did the work, and made everyone around her better. There's work to do, Margaret said to herself, the same way she'd said it 1,000 times in places that no one would ever know about. She headed to the ICU, closing her office door behind her. The past could stay where it belonged, honored, compartmentalized, folded into the shape of something that didn't have to destroy you anymore. She wasn't dead. She wasn't hiding. She was exactly where she was supposed to be, exactly who she was supposed to be. And if anyone looked close enough, they'd see it in how she moved, how she commanded the room, how hands that had held a man's heart in them now held everyone's hope. If you're enjoying the story so far, hit that like button. And I'd love to know, drop a comment telling us where you're watching from.